I think back when I was, working on my doctorate, one of the courses we had was that, in order to build a therapeutic alliance with your client, you have to be comfortable to ask questions, even the most uncomfortable questions. And particularly if you are of a different race or culture, it is important to bring that topic up. And usually it comes up within the second or third session, usually not initially, but it should be addressed because it can become the elephant in the room. And it's important to be able to talk about those things. Sometimes a client will bring it up because it's an issue the client is dealing with at work or at school or at home or just in the environment, and they will bring it up. But it needs to be addressed. Confront may be too much of a charged word, but to be able to talk about it in terms of how are things happening with you? Tell me what your life is like, so that some context can be put around the concern the client is expressing. And that can only be done if the therapist, the clinician, the mental health worker has some sensitivity and some understanding about what someone else may be experiencing and feeling. It's beyond sympathy, it's empathy and trying to be as close as you can to understand what someone else is experiencing. And if you can't, to be able to say, I'm not sure, I haven't had those experiences. Tell me more about what you're experiencing. And I know for clinicians to say that expression may be said 1,000 times, but it might have been the first time that the client in front of you has heard it. So it's really I think right now, I think it's important for clinicians to be educated and sensitive, I'll say culturally sensitive, about what my client is facing versus the problem the client presents, because it's usually some deeper work that needs to be done and unearthed. So racism, understanding what racism is versus being biased and being prejudiced, they're all different nuances. And during these climes, I think it's very important to be educated about it, to be able to converse with your client. So I think that's really important. Not confront, but to engage the client in those kinds of conversations to make some headway. There are some particular ways that clients may be thinking because of their experiences. So you really have to build that therapeutic alliance. Even if you have 20 minutes or you're going to see this client just for intake, you may make a different impression on that person to go forward in the system to talk to another person who that person will have to share the story. So the initial person that the person speaks with sets the tone for how that person will engage with whatever services are being offered.
Thank you so much. And that's really powerful to think of, like, peeling away the layers, because to the point of transgenerational trauma either, right? Just you start to peel away and you're going to find those things, even if they're not necessarily bringing that to the table to talk about.
Absolutely.
So, while we don't want to confront it, there is a responsibility as a clinical provider to probe a little.
Right, you have to approach it because, we're different. If I'm green and you're blue, I'm going to ask, tell me about being blue. I know what it's like to be green, but tell me about being blue. Versus, I understand you may have a lot of issues here. I'm not going to talk to you because you assume, one, I have a lot of issues and that you can help me when maybe all I want to do is to be able to feel open to talk about things that I haven't unearthed for myself. Very difficult conversations, but they're important. And one thing I want to say, I think Dr. Walsh, you pointed out a lot, and so did Miss Gerona, there's been an onslaught of people coming into therapy now. I am very happy to see so many African Americans seeking help. Men, women, children, adolescents asking their parents to get help. We've seen an uptick in suicidal ideation in African American adolescents, which has been unheard of in terms of it meeting or surpassing the numbers of adolescents of other groups. So we're very concerned about that. So there's, more African Americans are seeking support and help. We don't have as many African American clinicians. So those who are not African American may want to work more towards understanding what is going on with the clients today, because we're booked for months in advance right now, and that's a healthy thing, but it's also a heavy burden and an onus. So we need other clinicians to be aware of the role they need to play to help